From high atop Healthcare Hill in Central Maryland, this is BSN Headline News. Today's top story is Bon Secours Global Ministries is an active participant in building healthy communities and co-creating a more humane world. How? Through what we call our Healthy Communities initiatives. And most of us have already heard about the great work that is happening across the system. But what about the work we are doing in Peru or Haiti? In those two countries, our focus is primarily on women and children's health, which is one of the reasons Bon Secours was asked to participate in a UN-sponsored conference designed to address the UN's Millennium Development Goals 4 and 5. But wait a minute. Let's back up a bit. The Millennium Development Goals, what are they? Well, the Millennium Development Goals are 8 international development goals that were established following the Millennium Summit of the United Nations in 2000, following the adoption of the United Nations Millennium Declaration. Now, all 189 United Nations member states and at least 23 international organizations have committed to help achieve these goals by the year 2015. Goals 4 and 5 read: 4, reducing child mortality rates, and 5, improving maternal health. Now, stay with me here. Goals 4 and 5, reducing child mortality rates and improving maternal health, fall right into the focus of Bon Secours' work in Peru and Haiti, but more directly Peru. Which brings us back to one of the reasons we were invited to the A Promise Renewed for the Americas conference in Panama City, Panama in September of this year. Enter Camille Grippin, Bon Secours' Director of Ecology and Global Ministries. As a representative of Bon Secours Health System and the Catholic Health Association, Camille was a member of a discussion panel moderated by CNN's Claudia Palacios. The discussion was centered around how to strengthen private-public partnerships, and Camille represented the role of civil society. The conference was held from September the 10th through the 12th, 2013, and provided a regional forum to celebrate successes, review trends in reproduction, maternal, neonatal, child, and adolescent health in the UN region, the Americas. The conference was attended by hundreds of participants, including high-level officials of over 30 countries of the Latin America and Caribbean region, and was organized by the WHO, PAHO, USAID, IDB, and the Government of Panama. The meeting served to identify key interventions and strategic shifts needed to reduce persisting inequalities in health. Now, I know we've covered a lot of ground in a short time, but you can find out more online at www.apromiserenewedamericas.org, and we'll bring you updates on the happenings in Peru as we learn about them. In other news, $5 million. That was the fundraising goal to build Richmond, Virginia's first freestanding hospice and palliative care facility. And the Bon Secours Richmond Healthcare Foundation celebrated that goal on October 14th, 2013. During a luncheon for lead donors and campaign volunteers, Bon Secours Richmond Healthcare Foundation CEO Cindy Reynolds was quoted as saying, "We are extremely grateful to our donors who understand the value of providing a comfortable, caring environment for our loved ones at the end of their lives. The idea to build Richmond's first freestanding hospice and palliative care house, Old Bonaire Hospice House, grew out of the community's need to help complete the continuum of care consistent with Bon Secours' clinical transformation. According to Sister Vicky Segura, MD, CBS, hospice and palliative care physician, in keeping with the Bon Secours mission of caring for the sick and dying, The Community Hospice House will provide a high quality of life for patients with terminal illness while providing the emotional and spiritual support to their families. The Community Hospice House will have private patient suites, each with garden access, as well as common areas where families can spend time with their loved ones unencumbered by caregiving duties. Please join us in celebration of reaching our fundraising goal of $5 million for the construction of Richmond's first freestanding hospice and palliative care facility. Finally, it's that time of year, fall, when communities celebrate the change of the season with fall festivals. Fall festivals like the one in Warwick, New York, the Apple Fest. Since 1989, the Warwick Valley Chamber of Commerce and the Warwick Valley Community Center have sponsored Apple Fest, the largest fall festival in Orange County, New York. And for a good cause, to help raise money for town-wide community projects and nonprofit organizations. During this year's 25-year celebration, Bon Secours St. Anthony Community Hospital's Kennedy Birthing Center hosted a breastfeeding tent. This unique idea to support community mothers and their babies was spearheaded by Amy Fotino, RN, a maternity nurse at the Kennedy Birthing Center. The tent included privacy sides, rocking chairs, hand sanitiwipes, a diaper change area, water to rehydrate, a fan for ventilation, and soft music. On hand to encourage the use of the tent and to assist the moms were Bon Secours maternity nursing staff as well as members of the Warwick's Moms Group. All moms with babies were encouraged to take advantage of the tent regardless of formula or breastfeeding. According to Michael Jandro, Executive Director of the Warwick Valley Chamber of Commerce, we were very thankful for this unique service. This is another example of how our local hospital addresses the needs of our community by providing essential services. You know, I don't know if this was the first year for the tent, but what a great idea. The Bon Secours St. Anthony Community Hospital Kennedy Birthing Center's breastfeeding tent at the Apple Fest. Well, that's it for this week. Stay tuned to this portal for future up-to-the-minute information on these and other stories on BSN Headline News. I'm Dave Schlachter. Thanks for joining us. BSN Headline News is a production of Bon Secours Productions and is solely responsible for its content.